Hi, this is Amanda Lawton, Indiana State University LPN to BSN student for Community Health Nursing, discussing child maltreatment for Health Education Project number 4. Upon completion of this video, the viewer will be able to identify 4 types of child maltreatment, identify 5 risk factors for child maltreatment, identify 5 signs of child maltreatment, identify 5 long-term effects of child maltreatment, identify 6 ways to prevent child abuse and neglect. Please stop here for a moment to take a pretest to assess your knowledge of child maltreatment. The link is provided in the slide. Child abuse and neglect are serious public health problems and adverse childhood experiences that can have long-term impact on health, opportunity, and well-being. This issue includes all types of abuse and neglect against a child under the age of 18 by a parent, caregiver, or another person in a custodial role that results in harm, the potential for harm, or threat of harm to a child. There are 4 common types of abuse and neglect. Physical abuse is the intentional use of physical force that can result in physical injury. Examples include hitting, kicking, shaking, burning, or other shows of force against a child. Sexual abuse involves pressuring or forcing a child to engage in sexual acts. It includes behavior such as fondling, penetration, and exposing a child to other sexual activities. Emotional abuse refers to behaviors that harm a child's self-worth or emotional well-being. Examples include name-calling, shaming, rejection, withholding love, and threatening. Neglect is the failure to meet a child's basic physical and emotional needs. These needs include housing, food, clothing, education, and access to medical care. Child abuse and neglect are common. At least 1 in 7 children have experienced child abuse and/or neglect in the past year, and this is likely an underestimate. In 2019, 1,840 children died of abuse and neglect in the United States. Child maltreatment is costly. In the United States, the total lifetime economic burden associated with child abuse and neglect was approximately $428 billion in 2015. This economic burden rivals the cost of other high-profile health problems such as stroke and type 2 diabetes. Risk factors for maltreatment. There is rarely a single cause of child abuse or neglect. Risk factors for child abuse and neglect include child-related factors, parent caretaker-related factors, social situational factors, family factors, and triggering situations. Some child-related factors are chronological age of the child. 50% of abused children are younger than 3 years old. 90% of children who die from abuse are younger than 1 year old. Firstborn children are most vulnerable. Mismatch between child's temperament or behavior and the parent's temperament or expectations. Physical or mental disabilities, attachment problems, or separation from parent during critical periods. Premature birth or illness at birth can lead to financial stress, inability to bond, and parental feelings of guilt, failure, or inadequacy. Unwanted child or child who reminds parent of absent partner or spouse. Some parent caretaker-related factors are low self-esteem. Neglectful parents often neglect themselves and see themselves as worthless people. Abuse as a child. Parents may repeat their own childhood experience if no intervention occurred in their case and no new or adaptive skills were learned. Depression may be related to brain chemistry and/or a result of having major problems and limited emotional resources to deal with them. Abusive and neglectful parents are often seen and considered by themselves and others to be terribly depressed people. Impulsiveness. Abusive parents often have a marked inability to channel anger or sexual feelings. Substance abuse. Drug and/or alcohol use serves as a temporary relief from insurmountable problems, but in fact creates new and bigger problems. Character disorder or psychiatric illness. Isolation. Abusive and neglectful families may tend to avoid community contact and have few family ties to provide support. Distance from or disintegration of an extended family that traditionally played a significant role in child rearing may increase isolation. Children who are abused and neglected may suffer immediate physical injuries such as cuts, bruises, or broken bones, as well as emotional and psychological problems such as impaired social emotional skills or anxiety. Kids are kids, and sometimes they play in ways that result in minor cuts, scrapes, and bruises. These minor injuries are often found on bony areas of the body like knees, shins, elbows, and foreheads. However, there are other types of bruises that should be a red flag for possible abuse. Torso, ears, neck, or any bruising anywhere if the baby is not yet pulling up or taking steps. Child abuse and neglect can have a tremendous impact on lifelong health, opportunity, and well-being if left untreated. For example, exposure to violence in childhood increases the risk of injury, future violence, victimization, and perpetration, substance abuse, sexually transmitted infections, delayed brain development, lower educational attainment, and limited employment opportunities. Chronic abuse may also result in toxic stress, which can change brain development and increase the risk for problems like post-traumatic stress disorder and learning, attention, and memory difficulties. It can also lead to depression and anxiety in adulthood. Maltreatment can contribute to heart disease, cancer, suicide, and sexually transmitted infections. Violence against children is also a contributor to inequalities in education. Children who experience any form of violence in childhood have a 13% greater likelihood of not graduating from school. Preventing child maltreatment before it starts is possible and requires a multi-sectoral approach. Effective prevention approaches include supporting parents and teaching positive parenting skills and enhancing laws to prohibit violent punishment. All health and human service professionals have a role in preventing abuse, but particularly those who provide care to children or dependent adults in facilities, agencies, and programs. Criminal background checks are usually an important first step in hiring new employees, along with checks of child abuse and sex offender registries when applicable. The general public also needs greater awareness of the prevalence of child and dependent abuse, how to recognize the signs of abuse, and what to do when they suspect abuse. Professionals can help increase public awareness of this often hidden crime. Parent and caregiving support, information, and skill building sessions to support the development of nurturing nonviolent parenting. Education and life skill approaches, increasing enrollment in quality education to allow children to acquire knowledge, skills, and experiences that build resilience and reduce risk factors for violence. Also, programs to prevent sexual abuse that build awareness and teach skills to help children and adolescents understand consent, avoid and prevent sexual abuse and exploitation, and to seek help and support. Response and support services can help with early case recognition coupled with ongoing care of child victims and families to help reduce reoccurrence of maltreatment and lessen its consequences. Please stop here for a moment to take a post-test to assess your knowledge of child maltreatment. This is a poster with resources for reporting suspected child abuse and neglect. It also has some facts regarding child abuse.